Hey everyone, happy Wednesday. Welcome to the third edition of my video blog or vlog here on YouTube. As you guys know, my name is Amy Dixon. I'm a Paralympic athlete. There's my fancy uniform from the Paralympic Games in Tokyo in 2021 due to the pandemic. And last week I was talking a little bit about some of the exciting things that I plan to do to give back in the field of ophthalmology and to people who are suffering from vision loss like myself. So one of the things I wanted to talk about is one of the things that is most frustrating to me as someone who was running a support group and was a participant in an NGO, non-governmental organization that was a nonprofit to help glaucoma patient sufferers, is the common thread that I saw when people go to the internet or Dr. Google to deal with their symptoms of any disease. It doesn't have to be eye disease. It could be, your liver, your kidneys, your migraines, whatever. People go to the internet and end up following a medical advice by people who are extremely unqualified to give it other than their own experiences, which has some value, but it does not replace seeing a qualified physician and or specialist that specializes in your specific disease or problem. And so one of the things I wanted to do to eliminate that as a problem that many physicians face when they have a patient come in and say, well, I read this off the internet, is that I wanted to provide people with an educated person that immediately after they leave their specialist office is to sit down with a patient advocate, somebody who's been trained in that specific field. And for me, initially it's going to be ophthalmology, where say you walk in or your mother walks in and gets diagnosed with age-related macular degeneration. She doesn't quite understand. The specialist is in a big hurry because they're seeing 30 to 40 patients in a day, and they have a lot of questions that were unanswered or they forgot to answer at the time of the visit because they were a little anxious or nervous by the physician's white coat. We call it white coat syndrome. So they have this wonderful person, let's call her Susan, that they sit down with afterwards, who asks, do you understand everything about your disease, how it started, what the progression looks like, what your options are either surgically or medically, or if you choose to do nothing, what those outcomes tend to look like, and walking them through the process. Because a patient advocate is going to have the time to really spend with you to go through the specifics of your case. Also, one of the things that I find is a lot of people might be embarrassed that they can't come back. A lot of people work full-time jobs if they're in an office, or if they're a single parent or the primary caregiver and they're also working. This may be the only window that they had to get to the office. So how do we remove these barriers to care for patients using a patient advocate who can assess the situation, whether it's, your mother doesn't drive anymore and she lives alone and you live on the East Coast. How do we get her to and from her ophthalmology appointments? And that's where a patient advocate can come in and say, listen, these are the handicap transit or elderly person transportation in your area, or your health insurance may cover a voucher for Uber or Lyft. A lot of health insurance and Medicare plans do offer that as a benefit. So the patient advocate can look into this for you. Also, say again, you're a parent, that has a disease that needs to be treated. Maybe you need a Saturday morning appointment because during the week you're either at home full time with the kids or you're working yourself. Or maybe you need an evening appointment when the kids are home with another caregiver or a babysitter. Things to consider when you're looking at the patient as a person and not as a patient. For me, my experience has been very unique in that I'm lucky that I have a background focused in pharmaceuticals and in the sciences and also public health. And so where I see these loopholes and these gaps to care is where people fall through the cracks, because no one wants to be told that they have a permanent disease. It's a very scary diagnosis. And the first thing people do is either A, run like heck, or ignore it, because in the beginning there may not be any symptoms or very tolerable symptoms. And unfortunately, when they don't go back and follow up on their care, the disease then progresses to a point where you can't unwind the clock. And for me, I have a progressive eye disease that's degenerative. And had I gone back, this is now 26 years ago, to the doctor right away when I was initially diagnosed, I could possibly still be driving a car. I lost 70% of my peripheral vision within those first few weeks because I chose not to go back because I was embarrassed that I couldn't afford it. I didn't have any health insurance at the time. And again, this is where a patient advocate could have advised me, listen, there are patient assistance programs that we have payment plans, we can work out a cash price for you versus someone who has insurance, or we can get you on Medicaid and emergency insurance right away that will cover your treatment going forward when dealing with a long-term illness. So I decided to take matters in my own hands. Like, the reason why I'm talking about all of this is that I vowed to myself that as long as it was within my power during this lifetime, that the one thing that I can do that's going to have the biggest impact is that I want to make sure that no one with a treatable blinding disease loses their sight due to not complying with their care. And the way that I can do that is, back in 2021, Medicare made it billable and reimbursable through insurance to have a patient advocate on staff at any doctor's office. And so it's billed at, I believe it's about $40 or $50 an hour for a 15-minute consult, and there is no copay at all, and you can have as many visits as you want. So if you go and see the doctor on Monday, you schedule a visit on Wednesday with your patient advocate, and if you have still more questions, you can meet with them again on Friday at no cost to you. And so my goal was to train people in ophthalmology with a basic understanding of ophthalmology through both Alchemy Vision, which is a school out here in California that trains ophthalmology techs and ophthalmology billing persons that work in the office, and also IJCAPO, which is the International Joint Commission on Allied Health Professionals in Ophthalmology. And I've been consulting for them for the past 8 months, and I've been creating an exam and also a curriculum where people can take this course. The course is about 4 to 6 weeks, depending upon how many hours a day you want to study. It's a self-study, and then there's a proctored exam done online at the end of it. And in addition to that, I spoke with Lighthouse for the Blind because not only do I want to employ patient advocates in every major eye hospital in the country, but I'd love for a good percentage of those, if not most of those people, to come from the visually impaired community that I serve and that I also represent. So Lighthouse for the Blind is one of the largest nonprofits in the country, other than the Lions Club, that helps people with low vision do vocational rehab, help them keep their jobs, learn new skills, learn Braille, learn all the household safety tips that someone with low vision is going to need. And I'd like to hire people that go through this class through Lighthouse for the Blind and employ them as visually impaired certified ophthalmology patient advocates, because computers these days are 100% accessible, and this allows people to work from home. And 78% of the visually impaired population is currently unemployed, which is absolutely a disgusting statistic that I hear about all the time, and I want to put a stop to that. There's no reason that people who are otherwise healthy that have vision loss can work part-time, full-time as a patient advocate. And who better to empathize and sympathize with somebody who's going through the same thing? So I'm in the home stretch. I've created the exam. We're trying to put that to bed now. I've created the curriculum that will be available soon, and I will have more news in the upcoming weeks. I am hoping to launch this or announce it on some larger platform at the American Academy of Ophthalmology conference coming up in Orlando in October. So fingers crossed that we can get it together in time, but that's my great news. So if you're interested in becoming a certified ophthalmology patient advocate, or if you're low vision and looking for a job, or if you're somebody who is retired and worked in healthcare and want to make a couple extra dollars and also give back to the community by being an advocate using your years and years of experience, I want to talk to you. So DM me, whatever, on here, on Instagram, No Sight, No Limits, or again on Facebook. Thanks guys for listening, and I'll check in with you next week.